Diabetes is a chronic disease which affects how our body uses blood glucose, commonly known as blood sugar. Our body cells depend on glucose for energy, which we get from food. Too much or too little blood sugar can be dangerous. Our pancreas regulates our blood sugar levels by secreting insulin, a hormone which promotes glucose uptake by our cells. Diabetes is labelled type 1 or type 2, depending on whether our pancreas can produce enough insulin or not. Type 1 diabetes need daily injections of insulin, so-called insulin-dependent diabetes. Type 1 diabetes is often diagnosed in childhood. Type 2 diabetes occurs when your body does not produce enough insulin, or your body becomes resistant to the full effects of insulin. Type 2 diabetes usually appears gradually. Type 2 diabetics may need medication to manage their condition. Elevated blood sugar is sometimes seen in pregnancy. Pre-diabetes means having raised blood sugars but are not yet diabetic. Proactive diet and exercise can greatly improve these forms of diabetes. Type 2 diabetes is more common and incidence increases with age. A family history, being overweight, and a poor diet all contribute to developing type 2. Usually, type 2 responds well to diet and exercise, but medication may also be necessary to control blood glucose levels. Untreated, diabetes can result in significant health complications. It is easy to diagnose with routine urine and blood tests from your healthcare professional. Diabetes is characterized by too much or too little blood glucose. Screening checks blood sugars at different times. Irrespective of diet, glucose levels of 20 milligrams or more per milliliter of blood may indicate diabetes. Too much blood glucose is called hyperglycemia. Left untreated in some patients, hyperglycemia can cause a coma. Symptoms of hyperglycemia include dry mouth, thirst, frequent urination, blurred vision, fatigue or drowsiness, weight loss. Drinking water, reducing sugary foods and drinks, and exercising regularly reduces blood sugar. Too little blood sugar is called hypoglycemia. If untreated, hypoglycemia can lead to fainting or seizures and can be life-threatening. Symptoms of hypoglycemia include sweating, shaking, nervousness, hunger, dizziness, faintness, pounding heart, confused thinking, impatience, numbness of lips and tongue, headache, blurred vision, and slurred or slowed speech. If you suffer from hypoglycemia, you should immediately eat or drink fast-acting sugar, such as fruit juice, a tablespoon of sugar, or honey. Tell your family and friends if you suffer from diabetes. They can help you take appropriate action if you become acutely ill as a result of diabetes. If you are pre-diabetic or have diagnosed diabetes, having a diabetes control plan to help you control your blood sugars will make your life better and provide more energy. Diabetes management is tailored for each patient. Understanding your diabetes is essential. Your healthcare professional can explain the best options for you. If you have type 1 diabetes, you must regularly monitor your blood glucose level and use insulin appropriately. In type 2 diabetes, monitoring your blood glucose levels and enjoying a healthy diet with regular physical exercise will greatly improve your condition. Type 2 diabetes may also require administration of insulin and other medicines. As for any chronic condition, long-term treatment success depends on you. Some 8 to 9% of people worldwide suffer from diabetes. Almost half are unaware they have the condition. Diabetes is a chronic disease which affects how your body uses blood glucose. A diabetes control plan can help you successfully manage the condition. It provides you with customized advice on diet, blood sugar testing, exercise, medication, hygiene, and understanding of the condition. Following a diabetes control plan will enable you to control your blood glucose and enjoy a healthier lifestyle. Further information on diabetes can be found on educateforhealth.com, Diabetes Ireland, and International Diabetes Federation.